In today's Eye on Health, we're talking about an issue that probably affects someone you know in some way. It's addiction, and even if it's not your family directly, it could be a friend's uncle or a coworker's cousin who's struggling with addiction issues. And now, more and more frequently, it's addiction to opioids.
And to make it even harder, too often people are also dealing with the consequences of opioid addiction. They face another challenge, and that's the stigma that goes with it. While opioid use is a chronic disease, it's often treated as a moral failure and prevents people from seeking treatment.
Our first guest today says there's a way to fight that stigma, to promote recovery and to restore hope in our communities. Welcome Dr. Cesar Deleo, Highmarks Vice President and Executive Medical Director of Strategic Initiatives. Thank you so much, Doctor, for being here.
Good morning, David, Heather.
Yeah.
Nice to see you.
Good to see you. And this is always such an important topic to talk about.
Absolutely.
Let's talk about the stigma first, because I think it probably prevents people from getting help in so many ways, right?
It absolutely does. Stigma is sort of the mark of shame. It's self-imposed or it's imposed by society. Stigma can be attached to a number of things: culture, race, gender, but also health. And health in terms of opioid addiction it becomes a large barrier for people to come forth and to seek the treatment that they need. And of course, coming forth, being diagnosed, and then seeking treatment is what ultimately can prevent the consequences and too often death.
So how do we break down that stigma? I mean, there's a huge perception that it's their own fault for landing themselves in that situation.
Well, stigma is a problem in terms of what people perceive. Oftentimes people don't understand, or they don't, they're not aware of the facts. So one of the things that Highmark did this past year was it surveyed its communities in the 3 markets that it serves. And it found some very interesting statistics. First of all, I think you had already mentioned that 1 in 3 individuals have been touched by the disease. But one of the shocking things that we found out was that almost 80% of individuals who responded indicated that they believed that it was partially or fully the fault of the individual, which is nothing farther from the truth. Opioid addiction is a chemical disease of the brain. It changes the brain's chemistry and its anatomy over time, and then it sets up cravings. So what we've done is we've embarked upon an anti-stigma campaign in order to get people into treatment.
And in fact, there's a website as part of this to sort of educate people, right?
Absolutely. So what we have done is we've enlisted the help of an organization called Shatterproof, and we have the website. I believe you'll show it on the monitor. But we've enlisted the help of Shatterproof to allow Highmark members to be able to view online material that educates them on what is the opioid epidemic, what they can do when they see a family member who may be suffering, or a coworker. And it's a series of videos that are 5 minutes that last, that'll be going on for the next 6 months. And there's material that goes along with it.
And I went to that website yesterday, and it breaks it down in very easy to understand steps.
It is. It's very effective.
And so what else are you doing to help break the stigma, to help opioid addiction? And we were also just talking a few minutes ago about how meth and cocaine use is on the rise too. It's almost beating out opioid abuse.
Right. As opioid abuse is starting to be tackled, particularly with the law enforcement, we see the rise of methamphetamine again. And that's occurring in our community, in particular south of us in West Virginia. So some of the things that Highmark is doing, over the past 3 years, Highmark has contributed over $4 million to the community organizations in our 3 states that we serve. And that goes toward education and also risk reduction and harm reduction. So that's the distribution of naloxone to community organizations to save people. The other thing is we do education to schools. Our fraud unit this past year received a national award from the National Anti-Fraud Association for its work with high school students and educating as to the dangers of opioids and other substances.
That's great.
Yeah.
And in Western Pennsylvania, I believe they've now presented this to over 6,500 high schoolers.
Wow.
It makes a
Fantastic.
difference.
It really does.
Yeah, thank you, Doctor, for being here today. We appreciate it, talking about a tough subject. And to learn more about fighting opioid addiction, the stigma that goes with it, and how to get care by visiting the AHN Highmark website, and keep watching for our Eye on Health series here on PTL. It happens on Wednesdays, brought to you by Highmark, Blue Cross Blue Shield, together with Allegheny Health Network for your health.